Good afternoon, everyone. Thanks for joining us today for the second part of our collaborative series with the Michigan's Women Commission. Hopefully you were able to join us last week. Today we're going to be talking about domestic violence as it shows up in the workplace and how to make our workplaces resilient spaces for survivors and employers currently experiencing domestic violence. Last week for our first collaborative webinar, we covered menopause. We received a lot of very positive feedback, but I did get an interesting question I wanted to cover. Somebody asked me if we're suggesting that menopause is a mental health condition, and I think the answer, of course, is absolutely not. So if you've been following our work and watched that webinar, you know that with our Leo Labor focus on workplace mental health, we're really not talking about those things like known disabilities or otherwise, and we're highlighting workplace, societal, or individual factors that impact the workplace, someone's ability to work, or might lead to additional stress that's going to impact somebody's mental health in the long run. So if you missed last week's webinar or any of our prior webinars, they are all posted on our Leo Labor Workplace Mental Health page at michigan.gov/workplace mental health. And thinking about domestic violence as a male in a leadership role, I can tell you that this is an issue that I care about, but I'm not always aware of, especially if it's not obvious. So we wanted to have a chance to talk about that and provide some information for all of us today so we can either better recognize it, better manage it, and better help those that might be experiencing it. So I'm going to go ahead and kick it over to Cheryl Bergman, my co-host and friend with the Michigan's Women's Commission. Cheryl?
Thanks, Sean. Appreciate you partnering with us again for this important webinar on how domestic violence can show up in the workplace. The Women's Commission, the Michigan Women's Commission, was established by statute in 1968. We have 15 members appointed by the governor to serve 3-year terms, and our duties include surveying the women of Michigan, identifying the challenges they face, and recommending policies to address these challenges. Domestic violence is always at the forefront of our conversations. We at Leo have recently heard from some employers in Michigan that domestic violence is affecting their employees and impacting retention. It is not only an ever-present threat to victims and survivors, but it does indeed affect our workplaces and our economy. We have asked to include this session on domestic violence in the Mental Health in the Workplace series because it is very likely that someone you know is currently in or will experience a domestic violence situation. And domestic violence is never confined to the home. Employees who have abusive partners often experience self-blame and shame, suffer physical and psychological harm, and fear for the safety of others. An estimated 8 million days of paid work are lost each year in the U.S. because of domestic violence. That's the equivalent of more than 32,000 full-time jobs. And domestic violence costs employers about $8.3 billion annually from higher medical costs and lost productivity. As employers and colleagues, we should understand when and how domestic violence shows up at work and how to responsibly handle it. That's why I'm excited to introduce Holly Jasinski. Holly is the Training and Public Policy Coordinator at Resilience, Advocates for Ending Violence. She has over 20 years of experience in abuse prevention services and training. In her current role, Holly facilitates Resilient Spaces, a training program that equips business leaders, human resources professionals, and others to recognize and safely respond to domestic violence in the workplace. Resilient Spaces is a unique education program that can help you create a safer space for all of your employees and colleagues. Thank you for joining us, Holly.
Well, thank you so much for having me. It's a pleasure to be with all 108 of you. So I have some slides to share, so I'm going to go ahead and pull those up. There we go. Can you see my slides?
Nope, it's the desktop.
Okay.
While Holly's pulling up her slides, I forgot to mention at the outset that there's a Q&A box, and we're going to take as many questions as we can get to at the end of our presentation. So feel free to drop those in there at any time. And there's already a couple of important links and phone numbers in the Q&A box for all of those that might be participating today. And now we can see your slides.
Great. So we'll be talking a little bit about domestic violence in the workplace. This is a short presentation, so just know this is a broad overview. There's a lot to talk about when it comes to how domestic violence shows up at work. So really, just starting off, whether you see it or not, domestic violence is happening in the lives of your employees. Domestic violence is a pattern of abusive behavior used by one partner to gain power and control over another partner. Nearly 1 in 5 women and 1 in 7 men report having experienced severe physical violence from an intimate partner in their lifetime. So the prevalence is so much higher than most people think. When we talk about domestic violence, we're not just talking about physical abuse. There's a whole host of other types of abuse and violence and tactics that are used. That could be emotional abuse, economic abuse, isolation, exclusion, using dominance, intimidation, denying, minimizing, or blaming the other person. Sometimes you might hear the term gaslighting. There's threats. There's coercion, there's using children to manipulate the situation. And overall, what we see in any domestic violence relationship is an imbalance of power and control. So no matter what the abuse looks like, whether it's physical, sexual, emotional, or all different forms, power and control is always at the center of that relationship, that one person wanting power and control over the other. Domestic violence occurs in every community. Anyone can be a victim of domestic violence, regardless of race, age, gender, ethnicity, sexual orientation, education, or economic status. Domestic violence does not discriminate. The annual cost of lost productivity due to domestic violence is $727.8 million. So those are 1995 numbers. So that was quite a long time ago. I can't even imagine what COVID has done to this, because we know during COVID, domestic violence rates skyrocketed. 60% of domestic violence survivors report losing their jobs. 96% report that their work performance suffered as a consequence of the abuse. So when you think about that, at a time when someone needs income more than any other time, if they're trying to escape a domestic violence relationship, this is a double whammy for survivors. So losing their job, not having access to income, on top of trying to flee a domestic violence situation, puts survivors in a difficult, nearly impossible position. More than 7.9 million paid work days, the equivalent of more than 32,000 full-time jobs, are lost each year to domestic violence. But when people call in, there's, it looks like a sick day, or it looks like poor performance. It doesn't necessarily show itself as domestic violence. And that's the case particularly if there isn't physical violence, but if there are, threats, emotional abuse, financial abuse, those types of things. More than 50% of stalking victims report that at least one incident of stalking occurred at their workplace. So that could mean that the abusive partner is showing up in person, putting not only that victim, that survivor in danger, but putting colleagues, and other people that work in the same building, putting everybody at risk. And the connection between workplace violence in terms of a person bringing a gun to work, and that connection to domestic violence is very strong. So often we see with mass shootings that the shooter had a history of domestic violence. So these are just some examples of what stalking in the workplace might look like. So if it's not somebody showing up at work, this is what it could look like. So this ongoing harassment, getting texts all day long. Did you make it to work? Text me when you get this. I love you. Are you okay? Now I'm worried. And you can see how this person is escalating and then begins to start to accuse that person. Oh, is this why you were dressed up? That jealousy is creeping in. Keeping constant tabs on the person while they are at work. And you can see how distracting this can be, how stressful it can be, how it can really lead to disruptions. I mean, can you imagine getting these texts and then having to run off to an important meeting? It's just, adds such a layer of stress and difficulty for employees. On top of that, there's so much shame and self-blame around domestic violence that folks typically are trying to hide this type of thing. It's embarrassing to be in a relationship that where this is occurring. You feel like it's your fault. And so a lot of times this is happening and we have no idea that it's somebody on our team that's dealing with something like this, and that we're working alongside folks that are scared to go home at night because they're just not sure what to expect. And then some other texts. When did you go on lunch? Tell me when you're clocking out? Where'd you go? We need to talk. That constant texting. 60% of senior executives from Fortune 500 companies believe that their company's financial performance would improve if domestic violence were addressed. Unfortunately, there are no laws mandating any type of domestic violence training for employers, and there are no laws saying that we have to have policies around domestic violence in the workplace. And some additional ways that domestic violence shows up at work. So in addition to that, nonstop texting, trying to keep tabs on somebody, there's presenteeism. So showing up at work, but not quite being there because the person's distracted, knowing that their abusive partner is, it could be keeping them up late at night, they're tired, just have that tremendous amount of stress, they're experiencing trauma. So they may be physically there, but they're not mentally there. Maybe it's coming late to work, maybe it's leaving early, trying to make sure that they're home on time before their abusive partner can question where they are. Could mean using up paid time off. Or on the other hand, work is a safe haven so the person is looking for any excuse to be in the office, to be away from home. It's the one place that maybe they feel safe and respected. So impact on victims. Victims experience self-blame and shame. They suffer physical and psychological harm. They may begin to mistrust their coworkers. They may fear for their personal safety, and often they're isolated and they're just no longer engaged in the work. The impact on other employees, so this is the colleagues of the victim or survivor, they may fear for their personal safety. They may also avoid the employee who's being abused. On the other hand, they may become overly involved in the victim employee's personal life. So just kind of really diving in and trying to, rescue that person in becoming overly involved. They also may start developing mistrust of leadership if there appears that there's nothing happening to address the issue. So there are a lot of different ways that this, abuse that may be happening to one employee, this ripple effect and how it impacts the rest of the team, and how that team is functioning, and truly their physical safety as well in many cases. And this is a quote from a survivor that we were working with at Resilience. So Resilience is a domestic and sexual violence program. We're on the Lakeshore. We serve Ottawa and Allegan counties. And when we asked our client population about whether or not they sought out any assistance at work through supervisors or through their employers, these are some of the quotes that came through those surveys. So one survivor said, "I didn't say anything at work because I was concerned the supervisor would further scrutinize my job performance, breach confidentiality, and compromise my job security." So pretty good reasons why this survivor did not feel safe coming forward and disclosing what was going on at work. "I was grateful that my supervisor gave me a week off to heal from surgery after my ex broke my jaw." This is a real story. This is a woman living in the Ottawa County area. You know, to me, at a minimum, to be grateful to have a week off to heal after surgery, you know, that's just not enough. That's the bare minimum of the type of support that I think employers should be able to offer survivors of domestic violence. "I got written up for missing work the day after my assault." The level of stress, I can't even imagine. So some common tactics that come up in situations where there is domestic violence: sabotage. So an abuser may interfere with childcare, transportation, that person's ability to succeed. So certain things that we hear about, things like hiding keys, so the person's late to work, keeping the person's up all night to argue. We talked about stalking a little bit already, not allowing access to the bathroom to get ready in the morning, gaslighting about schedules. So this could mean things like, "You said you were going to pick up the kids from soccer practice. It's your day to do it. You already promised to do that." When, you know, just kind of flipping the script on that person. So now they have to leave work early, and just creating chaos in that person's life. Prohibiting the victim or survivor from attending workplace social events or doing things that all of us have to do sometimes, like working late or perhaps working overtime, receiving additional training, going out of town for conferences, those types of things that are all, you know, an important part of professional development. But someone that's trying to have power and control over another person will try to sabotage those efforts. With financial abuse, what we're referring to is not allowing access to earned money or in any say in how that money is spent. So a survivor is not allowed to purchase needed items. That could be uniforms, or, you know, in healthcare, maybe it's scrubs. You know, maybe unwilling to share in the household duties. So the person being abused is responsible for that second shift. Kind of enforcing those strict gender roles. So they may work full time, but then they're also doing all the household chores, all the child care, you know, anything that has to do with the kids or with the home on top of what they're already doing, and really enforcing those strict gender roles. So that could also mean, I don't want you working after the baby is born. I'll take care of you, you know, kind of enforcing those strict gender roles. Women should be at home. I'm the man, I'll work, you know, those types of things. So, you know, that scenario is great if both people are consenting to it and that's what both folks want. But when someone's being forced into that against their will, that is a form of power control over that other person. So some other things: the abusive partner feels threatened. So they're jealous of the partner's success, time away from them, you know, might be jealous of coworkers, supervisors. They may accuse that person of cheating, and they may fear that the person might disclose abuse to someone at work. Work is a lifeline for many survivors, often offers a respite from the abuse. It offers a sense of freedom. So I had one survivor tell me that she loved going to work, and she hated being at home. At work, she got accolades. She felt confident and appreciated. Work is what helped her maintain a good sense of herself and her worthiness. So she felt empowered and independent at work, and access to own money, and then her own money, and then also the social support and friendships. So we have a lot of connections through the workplace, and a lot of times for survivors, that is the one place where they feel supported and cared for. My boss said I was partially to blame for the abuse because I work in healthcare and, quote, I should know better. So this was another quote from the surveys that we did with our client population. So, I think when we think about how courageous it is for someone to come forward and disclose to their supervisor that this is something that they're experiencing at home, we need to be able to rely on supervisors to respond in a positive and supportive way. And this was really crossing the line here, and it's not helpful to that person that was experiencing that abuse. My colleagues avoided me because they didn't know what to say or do. Very common. I didn't tell my supervisor because I didn't want to appear weak and I was ashamed. That's very common as well. When we talk about domestic and sexual violence, what we're talking about is a lot of times people blaming themselves for what they experienced. And, there are a lot of myths in a lot of popular myths about victim blaming and things like that. And, kind of a general sense that, survivors should know better, or, a lot of times folks that haven't been in this situation say, I would never let that happen to me. Things like that aren't helpful, really blaming that person for what happened to them. And that creates this layer of not feeling comfortable coming forward, even though what's happening to the person is not their fault. So impact on teams, we talked a little bit about this already, that tension, gossip, distraction, reduced productivity overall, and decrease in morale and turnover. So some red flags that you might see at work could be bruising or other indications of injuries. So maybe injuries in various stages of healing. Clothing that doesn't match the season or weather, turtlenecks in the summer when it's 90 degrees out in Michigan, things like that. Unexplained tardiness, frequent absences. Sometimes it's just a pretty marked change in behavior. Somebody came in and was outgoing and a top performer, and then they become more and more withdrawn. Disruptive visitors, we talked about texting and phone calls. My coworker stood by me regardless of my decision to leave or stay with my partner and didn't make me feel ashamed or judged. So a much more positive response here. And my supervisor told me I wasn't alone, supported me when I needed time off. So overall, what to do? We need to seek training on domestic violence for supervisors and staff. We need to have workplace policies on domestic violence. Something that's really small is just simply hanging posters with domestic violence helpline numbers in restrooms and common areas. We want to protect someone's confidentiality if they do disclose that they're being abused. We want to set healthy boundaries. We don't want folks to have to rescue anyone. There are domestic violence programs with emergency shelters and with counselors, with case managers that are willing to help, that are experts in these issues, that can help walk alongside that survivor. We may want a safety plan. And then most importantly, we want to listen, we want to support, and we want to empower survivors who have had their voices taken away. And lastly, we want to believe them. So some resources here, you will get a link to these slides. And this is contact information for me if you want to reach out after. All right, I'm going to go ahead and stop sharing. And open it up.
Well, Holly, I have to tell you that very, very insightful and impactful. And I got a couple of things. We have a couple extra minutes. So Cheryl, if you're so inclined, might do a little bit of back and forth with Holly just on a few of my first thoughts, if you don't mind, on kind of how I'm responding. So as I kind of said at the outset, as a man, as a man in a leadership role, I certainly am sympathetic or empathetic to people going through different situations, but this isn't something I understand. You know, this isn't something that really makes sense to me. And I think one of the things that really stuck out to me is that we use this term domestic violence. And I think, you know, that's sort of the physical, we think about the physical part. And from your presentation, I mean, it would seem to me that most of what we would call domestic violence is not physical, that it's more likely those other things that's happening. Is that a fair statement?
Absolutely. And I would say the bulk of the survivors that come to us for assistance, it's the emotional abuse that really leaves scars that last quite a bit longer. So that's a lot of it. It's the threats, it's the intimidation, it's not necessarily the physical abuse, but all the other things that were around that power and control wheel that really you know, keep survivors trapped in abusive relationships.
Gotcha.
And I think it's important to remember, you know, as well, you know, I talked about some of the myths around victim blaming and the thought, oh, I would never let that happen to me, that it is extremely difficult to leave an abusive relationship. And the risk of homicide increases tenfold when someone is trying to leave an abusive relationship. So it's an extremely dangerous time, and for several reasons. But thank you for bringing up the emotional abuse and the other aspects that aren't physical. We don't always think of those.
Well, I appreciate you too on the, you know, seeing those text exchanges and seeing some of those behaviors. I think it's easy for me and many of us on this webinar today to say, I would never accept anything like that. I would never allow that to happen. And frankly, you know, my first thought is like, that's not going to be very helpful for people around me that might be trying to raise this issue in a very kind of low-key way to say, well, I would never let that happen. I think, you know, for me as a leader and as a human being, I'm going to make sure that moving forward that I'm more receptive to that message so I can understand that this may be an ask for help. It could be just conversation saying, look how so-and-so was acting today. But it could be the start of like, this is happening to me in a soft way. And any response that's just kind of like, well, I would never let that happen is not going to be helpful. And then Holly, as we were looking through that, it really struck me too that, you know, looking away from the physical violence as the primary tool that is happening in this situation, this probably isn't immediate either. So this isn't necessarily somebody that is, you know, just kind of more open to being controlled in this way. It's probably like a long run or lead time, right? That they get to the point where somebody has taken almost complete control of them. Is that a fair statement?
Yeah, absolutely. I'm glad that you brought that up too. You know, no one's abused on the first date, right? That's not how this works. It's domestic violence and power and control in relationships like this. It's very insidious. So, you know, I think it's important to remember that survivors come from all walks of life. Just, you know, like I said in the in the beginning. So, we're everywhere, I guess I should say. And so it doesn't start off like this. It starts off much slower, and it could be maybe there's a couple red flags, but also, maybe those red flags don't seem like they're particularly harmful. And the deeper the relationship goes, the more intense the relationship becomes, the more these issues escalate. So a lot of times when I talk to survivors, they may say something like, I thought this would end after we got married. Once my partner finally realized that I'm devoted to them and them alone, that, there's no reason to be jealous of other people, that I'm committed to them. But in fact, the marriage, the violence actually escalated after the marriage because the person had increased power and control over, over that survivor. So, and on top of that, other things like pregnancy, there's actually an increase of domestic violence when women are pregnant. And so, I think a lot of times we think, once this happens, the relationship is going to become more smooth. But relationships are on a continuum with healthy and balanced on one end to extremely violent where someone is being terrorized on the other end. And there's all different types of ways it can look anywhere in between there. And so I think it's important. It's not just that someone's getting those texts. There's a lot going on top of that, where the relationship became, the relationship got to a point where that is normalized.
Yeah, I appreciate that. I think just one last thought, and then we're going to open up the Q&A with our communications director, Erica Quealy. But one last thought is, this really ties into, if you've been following along with the workplace mental health work we've been doing, we talk about issues that are in the workplace, but also issues affecting the workplace and how trauma itself, because this is trauma, that chronic stress leading to depression, anxiety, those presenteeism numbers, and those types of things that are happening out there. And there's a great book called The Body Keeps the Score, that's talking about trauma, toxic stress, and those types of things. And it talks about why people in abusive relationships often go back to the abuser and how the psychology develops that makes it hard to disconnect. So when you talk about survivors, just kudos to them for making it over that hump. And for all of us, just recognize that it's really hard to make it over that hump. So anything we can do to be supportive is going to be helpful. So Erica, I'll turn it over to you.
Thank you, Sean. All right, the first question I'm going to ask, I think, has an opportunity for both Holly and Sean to weigh in. One of our viewers wants to know, what would be the best way to offer support to someone we have concerns about? And so, Holly, can you share some advice there? And then afterwards, Sean, I think, from an employer perspective, if you have anything to add in terms of resources for employers to use.
Absolutely. So I do a training called Resilient Spaces that's very specific to this type of work, and how to talk to someone that you're concerned about. So, if we start with the question, is everything okay? What do people say? Yep, everything's fine. So that kind of shuts things down. But what we coach supervisors and HR folks to be able to have the conversation where we dig a little bit deeper. So, well, the reason why I asked is that I've noticed that you've been late a lot lately, and that's just not like you. So just kind of opening things up like that. I think overall too, we really need to create cultures of nonviolence. So that means having policies around domestic violence and supporting survivors. That means having helpline numbers hanging in restrooms, hanging in public areas, just making it clear that this is an employer that understands the prevalence of these issues and that you might be going through this right now. So just kind of creating, again, those cultures of nonviolence and just helping people know that there are options for them if they need to come forward. They're not going to be blamed. They're not going to be asked, you know, why don't you just get out of there? You know, that there are folks that are going to be responsive if they need time off to see their lawyer, if they need time off maybe to receive services, or if they need to temporarily stay in a shelter. You know, I think that's a big part of it. But again, that resilient spaces training, we do really try to dig in with some case studies and examples of how to have those conversations. They're not easy to have, but when we ignore signs of domestic violence and we don't, you know, notice, we are scared to say something, we're missing an opportunity that could truly save someone's life. So, Sean, do you want to go?
Yeah, the only thing I would add is like we talk about often in our work, none of us in our as a supervisor, as a man, you don't have to be a counselor. And just always keep in mind that in your workplace, people aren't going to trust you just because your title is manager or supervisor or leader or anything else. They're going to trust you because of how you interact with them regularly. So if you need to be in a position where you're constantly thinking about how do I create the trust with the folks that I work with so that they know I'm approachable and that I'm open to these conversations, that I can be confidential, and that if they need me, I'm here. Because our goal really in any organization is to move the organization forward. It doesn't matter what our titles are, we're just all co-workers. And we just have different obligations for things that we need to do. So, you know, first and foremost, make sure that you're working to create trust wherever you are. And that's just by being, you know, open, being a good person, treating people well. It's pretty simple stuff. And then don't be a counselor, but make sure you have access to the resources. Don't diagnose people, right? Don't assume, but make sure that you can get people to the services that they need. And then a lot of employers have employee assistance programs and ESPs. Make sure that this is part of them. Make sure that that those ESPs know how to respond. Often, those programs that employers add might be a third-party vendor, and they're being evaluated for their business acumen more than their ability to provide services. And we, you know, when we look at who our ESP or EAP provider is, let's look at what the services are that they provide. Make sure that this is one of those tools. And then just always understand that it takes time. You know, certainly as Holly shared, with somebody in this situation, if they're finally at a point where they're going to open up just a little bit, it's probably been a long time of dealing with that shame and guilt. So make sure you're just don't push away.
Thank you both. All right, this next question is for Holly from our viewer Tammy, who's asking, do you find that an employee who is a domestic violence victim is more willing to confide in an HR representative or manager of the same gender?
That's a great question. I don't see any trend either way. I think it's whoever that person feels more connected to. HR has the added benefit of typically not having a close relationship with other people that are maybe working alongside that person. But, you know, it really just depends. I work with some really small businesses. I did a training for a nonprofit with 8 employees. So, you know, it really just depends. I think whoever that person feels safe with, and I just want to reiterate what Sean said too about we're not counselors. Boundaries are really important. I had a very well-meaning supervisor who let a woman and her children stay in his basement. And can you imagine what that abusive partner would have done had he found out that his wife and his kids were staying with her male supervisor? So I think it's, you know, maintaining those boundaries on top of, you know, it's a balance between being open and building trust and remembering that there are people in the community that are experts in doing this. You know, every county in the state of Michigan is fortunate to have a local domestic violence program where folks are trained to provide services at no cost and keep confidentiality 100% of the time. So.
Thank you for that. And if an employee confides about domestic violence in the is the best action for them, the employer, to refer them to an EAP or domestic violence hotline?
I think it's a matter of asking the person what they're looking for or what they need. How can I be helpful? Asking that question. I do have the number to our employee assistance program, and I also know that our local domestic violence program has an 800 number, and all of their services are confidential. I can give you both. I can give you one or the other. Just know that you're not obligated to call either, that it's up to you to make a decision about what's best for you. So that's how I would approach that.
Perfect. And I will note in the chat at the top, there are links and resources that anyone can use as well. And we'll make sure those are in our recap email that we send out with the recording of this event. The next question is from Debbie. Where can I get the posters for helplines?
Great question, Debbie. A lot of that depends on where you are. If you're in the Lansing area, I suggest reaching out to Eve Inc. and Violent Encounters Inc. They're a local domestic violence program. Another option, if you're not in the Lansing area, is to give a call to the Michigan helpline number. It was the number on I think my last slide. And you should be able to be connected to your local domestic violence service provider. It's pretty common for all of us to have some type of poster with a helpline number listed on it. So, and those are provided for free. Great question.
I know your presentation, Holly, noted a few signs to identify domestic violence, but we do have another question specific about in the workplace. Are there any other signs that you can think of to help employers or coworkers in the workplace recognize?
I think there's kind of the big red flags around, unseasonable clothing or, bruises and things like that. But also, I think sometimes there are things that we might pick up in the way people talk about their partners or their home life, or the way they don't talk about those things at all. One of the trainings, curriculums that I do is for hair salons and talking to hairstylists about how to recognize and respond to domestic violence. And one of the things that is a red flag that they hear often is, my partner doesn't let me X. So my partner doesn't let me cut my hair short, or he doesn't allow me to do this, or she gets mad when I come here because she's jealous. So I think obviously those are things that might be heard by a hair care professional, but I think there are other things that we can listen to no matter where we are, just kind of listening for those indicators that something may be not quite right. Things like, oh yeah, I don't think I'm going to be able to make it to the fundraiser, the golf outing this year. My partner doesn't like those types of things. So, things like that, where it's just kind of, oh, okay, that's curious. Maybe it doesn't mean anything, but maybe that's an indicator that that's an unhealthy relationship where that person has power and control, or is kind of dictating what that person does, who they see, what they look like, how they dress, those types of things.
All right, thank you so much. That's all the time we have for Q&A today. I'll turn it over to Sean to close us out.
Well, thanks so much, Holly, for the information today. Very, very helpful and insightful. Very helpful for me. I hope everybody that was with us today found it as helpful. I think it really, that concept of like, we're using the word violence, but that's not just what we mean. Kind of maybe makes it a little fuzzy to really understand what abuse could look like. You typically think of the black eye, but most of the time we're going to be talking about something else, emotional abuse, financial abuse, or otherwise. So very, very helpful to be able to pick up on those signals. And just thank you so much to Cheryl Bergman, the CEO of the Women's Commission, and Shannon Garrett with the Women's Commission on raising these issues. You know, I kind of shared with them when they first mentioned it, you do one of these, like, why are we not talking about this? Because this data lines up almost exactly with what we've been talking about can impact the workplace, either in the workplace itself or bringing it into the workplace and cause people to lose their job. Like you said, 60%. We don't want that to happen. Impact their job, 96%. We don't want that to happen. Presenteeism is extremely expensive in the workplace. So we want to be mindful of those types of things and make sure that we're doing all of the right things that we can do to the extent that we can to make our workplaces just better and stronger. So just thank you so much. We're going to continue to have a few more webinars through Mental Health Awareness Month. Next week, join us for the Stay Well program as they launch their wellness initiative that employers can bring into their workplace. And we're going to finish out the month focusing on the research around the 4-day work week and what they've seen in England and other places and how that's impacting people's mental health. And it seems pretty positive at this point. So thank you so much again for joining us today. And thanks to the Women's Commission for raising these important issues.